Hello everyone, I'm Dr. Nesma Dubal. I'm here today to talk about domestic violence. This is an educational video for NACOSKI exam purposes, and I did this video in cooperation with Star Med Medical Education Programs. Before we start this video, let's read the disclaimer. Let's start. What are the signs that may indicate the presence of domestic abuse? So, not every woman will disclose domestic violence directly to the physician. There are some symptoms and signs that may indicate that the topic of dissertation is about domestic violence. Let's see what are those signs. Women with domestic violence may not present with a complaint of domestic violence right away. She may have other symptoms that may indicate that she is abused. Those symptoms like insomnia, headache, depression, and anxiety, or maybe other somatic symptoms that cannot be explained by other medical conditions. It is okay to ask directly about domestic violence if you suspect that, but if you are going to ask this question, you have to use signposting before that. Signposting means you have to introduce to this question and tell the patient that you know this is so sensitive, but you usually include this question for all your patients as example for signposting. So, what we should ask in a case of domestic violence? Remember that domestic violence case is a very rich case, so physicians may have many questions to ask. It's very important to watch for time management in this case and also leave adequate time for counseling this patient. First of all, we should obtain a good history about the abuse. So we should ask the patient about the abuse experiences. What kind of abuse is it? Is it verbally, emotionally, physically, or combined abuse? And for how long she is getting abused? How severe is the abuse? And we can also ask about the factors that contributed to the abuse. So there are some factors, if it is present, it can contribute to the abuse, like if the patient or if the woman is the main earner of the house, if there is any history of drug abuse or alcohol abuse by the partner. We can ask also about weapons or any weapons involved or any weapons in the house. This question is very important because if weapons are in the house, so the life of the patient may be at risk. We can also ask about hospitalizations or emergency visits due to the abuse. This may give us an idea how strong or how severe is the abuse. It is very important to ask the patient if children are involved in this abuse. If they have children and the children witnessed the abuse or their children are abused, we have an obligation as physicians to involve the child aid services. Remember that domestic violence, we advise the adult to report it their own, but child abuse, we have obligation to report it as a physicians. Also, obtain a short medical history and ask about social history, drug abuse, alcohol, or smoking, and never forget to screen for medical illness. Ask about depression and anxiety, and also screen for suicide. Remember that medical history should be concise and short because if you consume a lot of time on medical history, you may lose the chance to ask another important question or counsel the patient on another point that is marked in the sheet. We should also ask about the patient support system. Who is supporting the patient financially, emotionally, who can have the patient back on those hard times? This is very important in creating safety network for the patient. And if the patient has no support system, we will find social services or any other community aid that can help the patient. So it's very important to discover from the beginning what is the support system of this patient. Now, how to counsel the patient with domestic violence. Domestic violence is a very sensitive topic to talk about with any patient, but we have to inform the patient the facts behind the domestic violence. Let's see the tips for counseling. First, state that domestic violence is a criminal offense and it is illegal to happen. We should also educate the patient that domestic violence tends to increase by time if she kept silent on that. We should advise the patient to involve the police if the violence is happening because involving the police tends to decrease or stop the violence. Inform the patient that if the children are watching the violence happening between their parents, this adversely affects their mental health and it causes mental health issues for them, as well as it may cause behavioral issues. We should express concern about the patient's safety and if her life is at risk. At this time it is a time to ask about the support and the plans for the patient. Create a safety plan for the patient to leave the home if she is at risk. If the patient has good support system, so it is okay. If not, we have to provide the patient with the local community resources that can help her during this tough time. Those community resources are like emergency housing or the legal aid, and some also social workers can be involved. We should offer the support and follow up for the patient and offer counseling session if she wants that. Thank you. This is the end of my video and good luck in your exam.